I'm Dr. J. Robert Seebacker of the Hudson Valley Bone and Joint Surgeons of Mid-Westchester County, talking to you about a new and exciting development that we're using in our orthopedic practice to help our patients with osteoarthritic knees tolerate and live with them without the necessity of undergoing surgery. For the last 15 years or more, I've specialized in trying to help individuals who have knees that are wearing out but not yet ready to have an operation, or unwilling to have an operation, or in some cases too sick to have an operation, to still live with and get the most out of their knees. This is done with a combination of treatments which focuses on reducing the inflammation, the swelling in the knee that causes the pain. We've all seen many patients with worn out knees who are lucky enough not to have inflammation, who still can be active and play tennis. The goal of our treatment program is to make that type of performance available to almost all the patients with worn out knees. So what do? We control the inflammation first by administering injections, 2 of them, a week apart, every 3 months, to our patients. Once that's done and their knees stop hurting, not only can they be active, they can be specifically active and exercise in ways that allow them to be strong and flexible so that their knees are cushioned by the muscles that control them. That takes the pressure off the knee. The knee then has less irritation, less wear, and we get into what's called a positive cycle of healing. The new development makes it easier and more reliable to administer the shots painlessly. And by easy, I mean, number one, the needle goes in without striking bone, even in very heavy or distorted patients. And number two, the needle always gets where it belongs, and therefore the shot always does its job optimally. So how do we do this? We have an ultrasound machine, which is basically a computer which provides images of what sound reflections show, transmitted in and out of this tiny little head, and the knee would be as such. The patient would be lying down, but for this demonstration we'll have it upright like this. We would want to take the needle filled with the special medicine and deliver it into a safe spot in the knee where there is no soft tissue, so that the medicine goes into the cavity, which spreads through the joint in a complex way but has no open air spots in it. In order to produce a convenient location to put the shot in, my other hand takes the knee and slides the kneecap gently to the side, opening a space in here which fills interestingly with air, in much the way if you pop your finger open and it pops, that's air rushing out of the circulation in your body into the cavity. And when that's open, we look for that spot with the ultrasound, mark the direction to enter it, which would be done with a guidance jig like this. And once that position is marked, then holding the kneecap over, the needle is driven down in that exact direction into that air bubble. It only takes a second, literally, to do this, put it in, give the shot, take it out. That way, all of our patients are assured of getting the medicine they need in the right place in the most reliable and predictable way, each time regardless of their shape or size. And then the medicine can do its job, stop their inflammation, let them exercise, be active, get stronger and more flexible, and get into that positive cycle of healing. It's Dr. J. Robert Seebacker signing off on this little demonstration.